Mike Gibson, Scott Salmon, coming to you live from ACC 2026. Scott, you reported here about a new drug in patients with heart failure. It's an NPR1 agonist, and it's called, I love these names, XSB750. Talk to us a little bit about NPR1, why you did the study, and what you found.
Yeah, hi Mike. Thanks for having me here. As you know, there have been lots of attempts to sort of tickle the natriuretic peptide system in patients with heart failure. For a while, we used nasiratide. Drugs like sacubitril valsartan cause an increase in natriuretic peptide as well, but this is an attempt to actually directly agonize the NPR1 receptor with a monoclonal antibody, which had a name called XXB750. It's a fully human monoclonal IgG antibody which targets the NPR1 receptor, and that has been shown in normal volunteers to increase levels of plasma cyclic GMP, which is the second messenger there. And the idea is that we could improve outcomes in patients with heart failure with a drug like this, that it would lead to reduction in NT-proBNP and an improvement in heart failure outcomes.
So is this a phase two, phase one, phase two, phase three?
This was a phase two trial in heart failure. The drug had already been tested in normal volunteers, and a parallel trial had tested the drug in patients with hypertension. And so we originally aimed to study quite a few patients, but the study was not completed, and we ended up randomizing 29 patients to placebo, 25 patients to sacubitril valsartan, 26 patients to XXB750 at a dose of 60 milligrams, and 55 patients to XXB750 at a dose of 120 milligrams. Now, the primary endpoint in the trial originally was reduction NT-proBNP, which we would expect if we appropriately stimulated the system. And unfortunately, that's not what we saw in the results. This was a sort of surprising result in which we actually saw that instead of increasing cyclic GMP, as we would expect for an NPR receptor agonist, we actually saw a decrease in cyclic GMP with both doses. We saw, instead of a reduction in NT-proBNP, we saw an increase in NT-proBNP with both doses. And importantly and interestingly, in the patients who were on background sacubitril valsartan, which of course has become standard of care in patients with heart failure, we actually saw that this was even worse. So interestingly and unexpectedly, we found that this drug was behaving not as an agonist, but as a functional antagonist in patients with heart failure in whom the natriuretic peptide system was actually activated. One way to think of this is the drug was sort of behaving as naloxone for
Mm,
sacubitril valsartan,
wow.
or for activation of natriuretic peptides. So interesting biology, unexpected finding. This obviously won't be pursued in patients with heart failure, but there were other programs that are ongoing, and I think we need to understand this biology a bit better so that we can better target the system.
S- Scott, what do you think the mechanism is behind this?
Well, it's a great question, Mike, and frankly, we don't know for sure because obviously this is a drug that was supposed to serve as an agonist for the receptor. And what appears to be the case is that under conditions in which the system is activated, either in heart failure itself or being further activated by sacubitril/valsartan. As you know, sacubitril, which is a neprilysin inhibitor, blocks the breakdown of the biologically active natriuretic peptides like ANP and BMP. And in that setting, we think that the drug is behaving as an antagonist. Why might that be? Well, at least there's some suggestion that there may be desensitization of the NPR1 receptor, which can occur potentially after prolonged or repeated exposures to high concentrations of natriuretic peptide, and that might be different from what occurs if you're having more pulsatile or intermittent stimulation of the receptor. This is an antibody that binds with the receptor, of course. We have no evidence that there are any anti-drug antibodies.
Well, Scott, another beautiful hypothesis with some ugly data, but that's why we do research, right? To get at the truth, find out the truth, and congratulations on a well-conducted study. A study that is well-conducted and yields an important answer is a positive study. So I don't care what people say. Well, thanks, Scott, for joining us, and thanks to all of you for joining us here live from ACC 2026.